There is a huge rise in the COVID cases globally. When we talk about Europe, the United States, there are in fact the cases that are on the rise. The symptoms remains to be the same, but what is really the reason that we are seeing that there is an increase in the cases of COVID-19? And what is really the situation in India? That is what we are going to focus about. What is really the situation as far as the Indian states are concerned? What is really the COVID cases? What is the upsurge? Is there an upsurge in the cases? So right now we are seeing that for past 2 to 3 days there is in fact a slight upsurge in the cases of COVID-19. In India, the active caseload has in fact been around 166 cases that has been reported since Sunday. Now last week there are about 80 cases overall in India, but within the span of about 3 to 4 days the cases have in fact risen to about 166. Now what is interesting to note here is that the majority of the cases that are being reported out of this 160, 90% of the cases are being reported from Kerala alone. Now, what is the reason that Kerala is seeing an active caseload? As far as Kerala is concerned, till last month, the caseload was around 33. It was only active cases were around 33 in Kerala, but within a span of 1 month, 750 cases are actively being reported in Kerala. So what is really the reason behind this surge? Now, when we talk about the surge, there is a subvariant of Omicron, which is JN.1, which is doing the rounds, is what the Kerala Health Department has been saying. JN1 is something which is a subvariant of Omicron, which remember has been there for quite a period of time, and it has a multiple subvariants, and JN1 is one of those variants. This is the same variant which is doing the round in US and in Europe as well, and that is exactly what the cases are being reported in Kerala as well, and that is why we are seeing an upstick in the COVID cases. Now the question is, how is this variant? Is this variant dangerous? How can we protect ourselves and our loved ones? So as far as JN1 is concerned, it is of course highly transmissible, but at the same time the symptoms remains to be same as far as the other variants of COVID are concerned. The symptoms are fever, headache, vomiting, diarrhea, all those symptoms that any variant of COVID-19 existed, the symptoms are very much similar. So what is really the prevention, or what are really the steps that one can take to ensure that they don't get infected? That also remains to be the same: wearing mask, washing your hands, maintaining social distancing as much as possible. But as far as this JN1 is concerned, there's nothing to be panicked about, is what the Kerala State Health Ministry has been saying. And when it comes to the Union Health Ministry, they are also in fact been saying that they are closely monitoring the situation, not just in Kerala, but across the country. They are going through whether there are in fact, what is the reason behind the upstick. They are doing as much as research and tests are possible, and they are closely monitoring and are in talks with the state health departments to ensure that the situation don't go out of hand. So as of now, there is nothing to panic, is what the health ministry as well as the state health department in Kerala has been saying.